It's another day with the physicians where your health is our business. Growth spurt the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what you know is
You're welcome back to the training author of your regular program. Depression is a mental health disorder characterized by prolonged unhappiness or irritability, accompanied by a constellation of somatic and cognitive signs and symptoms such as fatigue, apathy, sleep disorders, worldliness, or recurring thoughts of death or suicide. In today's episode on The Physicians, we'll be talking about depression in children and adolescents. We'll also talk about deep expression. Deep expression is a transformative book that weaves an electrifying tale of loss, grief, love, and redemption. The story of the character Brenda awakens us to the menace and claws of depression in its organic progression, all the way to its full evolution, while addressing some deep-seated issues and preconceived societal constraints. It is an important conversation and an essential body of work for anyone who wants to go beyond the awareness of mental health, especially depression, but seeks to take it head on. Find out on your regular program, The Physicians, as we have a guest that will surprise all of you. We'll be back after this short break. Hello there, welcome to your regular program, The Physicians, where your health is our business. Today we'll be talking about a topic that is very, very close to my heart. Talking about depression in children and adolescents. And also we'll be talking about something that is very, 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 very close. It's called deep expression. Well, my name is Dr. MARTINA, AGBERIEN, and I'm not alone as usual. With me is my co-host and author,
Dr. YUSUF, KADIRI, and of course, welcome to The Physicians, where your health is our business.
Wow, congratulations!
Thank you.
You made it, you made it. Author, well, Dr. YUSUF, KADIRI, my co-host, is a consultant, psychiatrist, a neuropsychiatrist. She's a celebrity shrink. She's a psychotherapist. She's a therapist. And of course, she's also an author. She writes. We're going to be talking about depression in adolescents and children. So let's hear from her. Today, now she's not going to be a co-host. Let's hear from the consultant herself. Tell us about depression in children and adolescents.
Yeah, so depression has been a big issue in our society, and is a serious mental illness. And the fact that people loosely use the word depression. "Oh, I think I'm depressed." No, you aren't depressed, you're sad, because depression is a serious mental illness that affects the way we think, the way we act, and of course the way we behave. And it presents with symptoms such as, persistent sadness. Sadness not just for a day or two, but sadness that has been ongoing for at least minimum of 2 weeks. That's why you don't use the word "I'm depressed." You're sad if you're just sad for a day or two, not depressed, because sadness is part of depression. Other symptoms are low energy level, when you just feel as if you don't even have the energy to do anything. And one other very classical symptom is loss of interest in things ordinarily you love to do. So now we are still within the COVID period, so you won't talk about really parties and all that, but you talk about interacting with people you want to interact. Watching television, you don't want to watch television. Men that love to watch TV, play PS4, PS5, they don't even want to do that. Women that love to, chit chat, discuss, catch up with other girls, tea party and all that, they don't even want to do that. But there are other symptoms that may not be as classical as change in the mood or change in energy level, low energy, or even loss of interest in things ordinary, things you love to do. But in sub-Saharan Africa, where we have malaria, they may mimic what we call malaria, symptoms as if you have malaria, like changes in appetite. If you are not eating when you think you have malaria, right? It's also a symptom of depression. Then change in sleeping pattern, you are not really sleeping well. Then also, concentration levels are down, you feel easily tired. But it can be so bad when you start feeling hopeless, worthless, and helpless. So those are the times when you start feeling suicidal, and that's when you start thinking, this world is not worth it, I want to kill myself, I'm tired of everything. And it can be as bad as when you start hearing voices or even seeing strange things, or maybe we're thinking that people are after you. You see,
and you think they really experience it?
You think, yes, people, because that is,
they hear the voices.
They hear the voices, because it's a severe form of depression, because depression can be mild, moderate, or severe. So it's not just depression in general. So people can have the mild form and they are very functional, they are doing other things. But when it comes to that moderate to severe, they may now need medication, admission, and all that. Okay,
so talking about depression, now you just talked about getting to a stage of being suicidal. And we're talking about depression in children and adolescents. How do you recognize depression in children?
Very beautiful question, and that is one thing adults need to understand, because in adults, is all those symptoms I talked about is easy to easily identify, but in children this is not so classical. What I would tell adults to look at, whether you're a parent, a teacher, or educator, a guardian, what has changed. So the word change is what you should look out for. What has changed in your child today that's different from who he or she was yesterday? So is she not eating too much or not eating at all? Does she come to the dining table when you could normally have your breakfast together? Is she locking herself up or himself up in the room these days? Is he becoming even rude or irritable or out of conduct? Those are some of the things. But one thing I have seen in my practice that people come with is that my child's academic level it has dropped. He or she is struggling. What has happened? Or the teacher will call the parent and say something has happened. So that is one thing that parents quickly look for help for. But most time these symptoms are insidious, meaning they come slowly. Not all of them come in full force. So things have changed over time, and you are just realizing that because the academic level has dropped. Yes.
I'm sure during the pandemic, right, you saw a lot of cases.
But let me tell you
during the
what
lockdown.
happened. Before the pandemic, our cases were just less than 5% of what we see in the hospital. But right now we have over 20% of our patients as children and adolescents. Yes.
Over 20%. Just hold it right there. We'll talk more when we come back from this break. I'm sure you heard her right. She talked about 20% of children presenting during this pandemic with cases of depression. Well, we'll be back after this short break. Let her tell us more how she's able to diagnose children, recognize children below those ages of having depression. Let us keep up with the physicians outside and see what they have to say about depression, if really they believe that children or adolescents can be depressed.
depression is a state of mind that enhances all the broken down of your system.
Pressure starts many ways, like hard labor, stress, all those kind of things like that.
Depression can be easily defined as unhappy or being loneliness.
No. That's those were those yesteryears. Yeah, Nigerians used to be the most happiest people on earth. But with the present situation, now what makes people happy? It's when you are able to take care of your immediate responsibilities, when you're able to meet up with the demands financially. But these days, because of you have a lot of bills to pay, you have a lot of things off your sleeve to think about. So naturally, there's no way you'll be happy. That's even when depression sets in.
If I may remember vividly, 1999 is far back, years back. Then Nigeria was still one Nigeria. But this time around, a lot of agitation. Igbo wants to go on their own way. Yoruba wants to go. It's only Hausa that never say anything for now. But a lot of confusion is been happening due to terrorist attack everywhere.
I don't think so for now. I don't think so, because the way things are for today, I don't think there is something like that again.
Lack of being able to meet up your responsibilities, the economic situation, peer group, your environment, and most other things brings depression.
The situation of Nigeria for today, look at everywhere, things turning so rough for everybody.
So depression can be caused by children seeing their parents fighting.
Yeah, of course. Lifestyle, to a very large extent, has a lot of effect on depression.
Yeah, I can say yeah.
Look at the Nigeria situation now. A lot of young youths are looking for a job and they don't find a job. So someone can easily be addicted with drugs.
Whatever comes from top flows down. If your parents cannot meet up with your responsibilities, with his or her responsibilities, automatically it naturally flows down.
Depends the family they comes from.
Whoever has a parent that cannot provide for his or her needs can be depressed.
Welcome back. If you're just joining us, here onto your regular program, The Physician, where your health is our business. Today we have in the studio with me my co-host and also a consultant, neuropsychiatrist, and of course an author of a book. She's also a psychotherapist. She is a celebrity shrink, Dr. MAYMUNAH YUSUF KADIRI. She's been talking about depression in children and adolescents, and also she also wants to tell us about something that she wrote in her book, Deep Expression. I will do that after she's explained to us how she's able to recognize children that have depression.
Yeah, thank you very much for that. And when the World Health Organization actually said that half of all mental illnesses start before the age of 14 and 2/3 before the age of 24. So if we have 100 mental illnesses, that means 50 will start before the age of 14. And this is the reason why parents, teachers, guardians, concerned adults out there need to know that children can actually be depressed, and they don't come with those classical symptoms like I said earlier on, but we just have to watch out what has changed. And one very bad thing that can come with depression in children is that they can easily be influenced, peer pressure, and they start self-medication, and self-medication can now lead to addiction. So you find out that they are not only depressed, they may come with drug addiction. By the time you are trying to manage for drug addiction, you find out that the underlying reason why they got into drugs at all was depression. Wow. So they're trying to medicate, because somebody said, take this blue pill, I think it will help you, and then marijuana has been found to be the main culprit when it comes to elevating their mood, because they just need something to just elevate their mood and something to make them feel good. So that peer pressure, if you know what's happening, 1 day, 2 days, 3 days, before you know it's happening, they start increasing the dosage of the rap, and then addiction setting. So it's never really classical. Watch out what has changed. Is it sleeping too much or not sleeping at all? Is it becoming more irritable or not? Is the child even telling you? Because millennials and Generation Z have been found to be the therapy generation, meaning it's very easy for them to come to you as a parent and say, I think I'm depressed, dad and mom, and I need therapy. Mom, dad, this is the time for you to know this. Because don't be in denial.
Exactly, because most parents really do not believe in therapy. Yes. They don't even want to know that their children are depressed because of stigma.
Yes, don't be in denial, and that led to this book, Deep Expression.
Okay,
truly, yes, because Deep Expression, I've been trying to write. You know what it is like? I need to write, but people have been telling me, and I keep writing. Over 2 years, you know, almost 20 years of my experience is in this book, Deep Expression, and it focused on depression at this point in time. It's 1 out of 3 books that I'm writing. So this is on depression, there's one on anxiety, and then there's one on drug abuse. But I'm happy this has come to light at this point in time. What I really emphasize in this book is for parents to understand that children also can get depressed. And when they come to you like that and tell you that they are depressed, don't be in denial. Rather, listen to them not judgmentally, so you can understand what they are dealing with rather than responding. Because it's very easy for you as a parent to say, you have a roof over your head. Do you know how much I pay for your school fees? You go for summer. Oh, COVID didn't allow us to go anywhere anyway. So, and all those other things. But the children don't care about that. They just want you to listen. They want you to understand what they are going through and help them seek help. Seeking help is a sign of strength, never a sign of weakness. Don't think people will laugh at you. Who cares anyway? Who are these people?
Some response, some children will tell their parents, I think I need a therapist. And the mother will respond, do you know what it means to see a therapist?
It's not our portion. God forbid. It's a spiritual attack. Yes. Come on, keep quiet. Let's fast and pray.
Don't even say that again. God is telling you that I need a therapist.
And that has led to death of some of these children. I've had a 9-year-old who has killed himself, a 14-year-old who has killed himself. So people, and I'm not talking about when I was in the UK or when I was in America, here in Nigeria.
What do you think is responsible? Social media?
Social media is also one of it, and it's in this book, Deep Expression. For me, viewers are definitely going to win this book. That's why we are here. So you are going to win this book. Why? Because I want this book to be in the hands of every Nigerian. To create that awareness, to be able to know how you can help yourself and help other people around you, especially our children and our adolescents and young adults, because they have a future, they are our legacy. It's a storytelling. I'm not saying this depression is this. No, it's storytelling about Brenda and her family and the loss and the grief and the depression that came with it, and how they finally saw the light, got help, got treatment, and got better. Depression is treatable, beatable, and of course, manageable. It may not be curable just like many other medical conditions, but it's treatable, manageable, and of course, beatable.
I totally agree, because oftentimes people do not believe that depression is also a medical condition.
Exactly. They just believe it's a taboo, it's a spiritual attack, somebody is doing you.
And I think this book I actually want to recommend that people should get this book. You know why? As soon as I started reading it, dropping it was difficult. It was so good. I was like, yes, I didn't want to get to the end. I just kept reading.
I need to put a caveat here. If you try reading this book by 12 midnight, trust me, you're not going to sleep that night. You want to know what happened at the end. So try to read it in a very relaxing mode during the day. Get the grasp, because you may not sleep that night. I'm not promising you, but most likely you're not going to sleep, because you want to know what is happening in the next chapter, in the next page. It's very exciting. It's free for medical jargons, and it's like the A to Z of what you need to know. Very relatable, and it's all about what you need when it comes to depression, not only in children and adolescents, even in adulthood. And one word I need to let people know that is in this book is languishing.
Languishing, yeah.
Languishing has been known to be the neglected middle child of mental health, where you are not depressed but you are not flourishing. And a lot of us are there right now. You don't have motivation, things are not moving for you, but you are not moving on, you are not productive, but you are not having those classical signs of depression that we talked about. So are you languishing? And what you can do when you feel languished is right here in this book.
Okay, so for the adolescents, word of advice for them?
For you adolescents, you are our future, you are our leaders, and we are here for you. We will promise you to be able to listen to you non-judgmentally. So if you are dealing with anything, let us know. It may be us, with your parents, that may be the reason why you are acting out. Let us know about it so that we can be able to encourage you to get help from the right places, the right time, and of course the time is now. Suicide is not an option. Depression is treatable, like I keep saying, manageable, and of course beatable. So adolescents, you are creative, you are awesome, you are beautiful and wonderfully made. No matter the trial, difficult times and the chaos surrounding you, there's always light at the end of the tunnel.
Good one. And for the parents out there, depression is actually a medical disorder. It is not a death sentence. In fact, when people tell you that, when you hear a child tell you, I need counseling, I need to see a therapist, please take that child very serious. Because you may not be out there seeing what is happening in social media. The child is actually more on the social media than yourself. And when he or she says she needs a therapy, it is true. Just go and get one. Do not begin to say, there is a stigma. It doesn't run in my family. Whose family does it run? Everyone, every human being has an element of being depressed. Something can actually just trigger it. It just needs a trigger factor for it to come out. So let us be more serious. Look after your children. Mothers, pay more attention at home. Fathers, also pay more attention to these children. Don't begin to say because the child is an adolescent, he's just a child, he doesn't know what's happening. Most of them actually know much more than yourself. Well, Dr. Kadiri?
Yes, and of course we have giveaways for this book. Just send us a mail to the physicians and let us know why you want to have this book in your library, on your table, and of course as a keepsake.
On the final note, I'm sure you've totally enjoyed all that has been said, talked about depression in children and in adolescents. It is real. For instance, there was a particular young boy who came telling me that the picture frame in the house was winking at him. At that point, I knew that the child, he needed to see a therapist. How have you paid attention to your children? Do you have a depressive child at home? Is there a mood swing? Is the child's appetite gone? You need to look at things that are very important that the child used to do before and no more doing again. Let them be able to speak with you. Don't be a parent that always watches the child when the child wants to speak. Believe in your children and they will also believe in you. On this note, I want to say thank you for staying tuned and keeping up with the physicians out there. We also want to say thank you for always being with us. And for everyone who has always kept a date with us, we want to say thank you too. But then don't forget to follow us on our social media handles, YouTube, Instagram, Facebook. And don't forget to send us email because we're just a click away. And we'll be there to bring you as one of our guests. Remember what Dr. MAYMUNAH said? You'll be able to win this book. Just send us an email on why you want this book. Stay tuned next time, next week. Big back.
And of course, remember, no one has absolute immunity when it comes to breaking down or having a mental breakdown or even having depression. And there's no vaccine yet. We saw, we immediately there was vaccine for COVID-19, no vaccine yet for mental illnesses. So please let us encourage help-seeking behavior, build a culture of compassion so people will be able to speak up, speak out, and receive help from the right places, the right people, and of course the right time, which is now. Depression is beatable, manageable, and treatable. Medication, therapy, counseling, or even admission if it needs be. So till next time, I remain Dr. MAYMUNAH YUSUF KADIRI. Stay blessed.
Stay blessed.
My name is Dr. Femi Ogunremi. I'm the CEO for Monitor Healthcare. I'm a medical doctor and also a medical educator. I'm here on the Physician Show and I would encourage everyone to watch this program. Today I've talked about cardiopulmonary resuscitation, which I believe is a way to save a lot of life.
So we talk about asthma. Is this condition where you have chronic inflammation of the airway? So for no reason, the airway begins to behave as if something is irritating it, and therefore it swells, the lining swells.
You talked about your friend, you know, if you were not there, she will not have been able to, you know, get the kind of help that she needed. So asthma should not be hidden.